wagwe gonzo what's good. De go do di ujats. Wax kareo in guadi ekits de nega no sesne. Then wakino warado nega runesne. Ramhagiga garotskade. This young, nice gentleman. And I also am grateful to IHE for allowing me to be here in place of some people who gave me guidance, hopefully, and told me not to be nervous, but it's not helping. So anyway, so let me begin by saying I spoke in my language, which is Kahnawake, because we're Kahnawake people from Kahnawake. Mohawk territory, okay, and it's okay. We'll be talking about it throughout the couple of days that we're here. So, okay, I'm talking about Kahnawake. Who's yeah? Okay. Otherwise, I would have went bring because I go to the schools often. So this is what this is how I usually show the kids, or they usually give me that little what do you call it, so that I can change the page. Okay, Kahnawake, of course, is near the Montreal, and we're about 10 minutes south across the St. Lawrence River on the Mercier Bridge. Could take 10 minutes, or if it could take 2 hours, depending on the traffic at the time. So we're about 7,500 on reserve, and we're about 13,000, what do you call it, but the rest of them are, of course, iron workers or program managers or program coordinators or whatever off reserve, and sometimes they take their families with them when they go. Of course, as everybody else, we have the imposed Indian Act, haha, yay. That was given to us. That was given to us in 1876, and we have two government systems going on in the community. One is the Mohawk Council, and but we also have a traditional government, which is part of the Five Nations Confederacy. So we've been able to take over local education, social services and health, recreation, and cultural center, as well as economic development with our own agreements. Okay, as in all other indigenous communities, ours is no different, where we have the stats, because there was a doctor that was working in the community who started looking at some of the patients that she had and realized that their stats were going up for, what do you call it, triggering diabetes prevalence. And so she managed to find a what do you call a medical student who could come over to the community and start compiling the data for what do you call the presentations that they were going to make to the community. They also did presentations to the band council in the community, and but it was one of the ones that they did for the community at large, was that the elders had said that they wanted to have something done for the children. They were already living with diabetes, but they also wanted the children protected, because for us, our community value is the children, because they're our future. So there was, they were instrumental in developing a proposal to, what do you call it, sent to granting agencies, and they managed to get money. And so that was our link to the university. And so the future generations thought, it's spelled wrong, okay, promotion of healthy eating habits, daily physical activity, and a positive attitude. That was the goals and objectives too. They had given presentations to the community, but they also did it to different organizations within the community. And these are some of the goals and what do you call objectives that they came up with. And so, of course, they came up with the community vision. And so I'm not going to bother to read it to you, because it's on the the slides anyway. But I guess for us, the important part was that university and community partnership that developed. And within those partnerships and the presentations that they did to the community, we managed to get the education center and the Cattery Hospital, because it was the doctor who identified the issue. And it's because the elders in the community identified the issue with the children. That was the partnership that started. But we've also had different partners in McGill University, as well as the University de Montreal, if I hope I said it right. And we also have different, because we've lately gotten involved with Queen's University as well. So what we've included in part of that was that decision-making process of, again, identifying the fire and the well keepers, and identifying the process of that decision-making whereby the Community Advisory Board is following that decision-making process in all the meetings that we have. So this is the Community Advisory Board, and we've gotten together from 1994, and they keep giving me coffee, so I keep coming back. What can I tell you? So it's made up of education, health, recreation, the political body, which is the band council, social services, economic development. We've had a spiritual advisor there as well. We've had the cultural center, and environment, and as well as the community at large, and social services. So, anytime that we do presentation, the Community Advisory Board is responsible to represent the organization. It's once a month meetings, and it's potluck because we don't have money. But we're creative natives. We always do what we can with whatever resources we have, right? So it's a volunteer participation, as I said, monthly meetings, and it's also, we gather the information from all the different organizations, and then we sit and deliberate as to whether or not we're going to be involved in whatever. Because it initially started as trying to give them healthy suggestions at their organization level, and physical activity ideas, as well as trying to reduce stress level of the people that worked within the organizations. Then it since has evolved into all different other kind of activities that we do, because our organization, which is Community Advisory Board, and the staff is made up of an intervention, a school intervention facilitator, as well as a community intervention facilitator. So they work together, but at the same time they come from different aspects of the community. So we have been involved in quite a few initiatives that happen within the community, as well as help with local organizations, and we are supposed to be ambassadors of health, so we try to practice healthy living, because eyes are always watching. And they know, because we already have the health police, which is, sugar police, as we identify, which was Alex. This was supposed to be Alex's presentation, and he's on the horn with me, emailing me constantly on Facebook, saying that he's the sugar police has identified that all these candies that they're giving out for Halloween is poison, and for them to drop it off at his house. He never sleeps, you know what I mean? He's always constantly going here. And anyway, so that's not part of the presentation, but I just wanted you to know, just to make it personal. Okay, the other part of it is that, this is, yeah, you can have that one, but you can look at it on that's okay, just go to the next one. Yeah. Okay, with us having the Community Advisory Board, and which is connected to the community, and we have researchers that are students, as well as what do you call it? We have the advisory at the university level, and we have our intervention staff as well as our research staff. So, and what we've done is what do you call it? Start looking at the meetings that we have, because we have our advisory board meetings, and then we go to the research team meetings at the university. Sometimes they come to the community, and as we started talking throughout the years, we started coming up with this reciprocity, where they were learning and so were we. We became just as good at being researchers as well as them learning about community knowledge. So it's been, what do you call it? We started naming it as ethical space because we found the, what do you call, Willie Ehrman. That, I mean, maybe Jeff knows his title, because I don't know his title. I just know him as Willie. And so what we've done is, in that ethical space, what we've created is that reciprocity. We've done that respect. We've done, you know what I mean? Everything that everybody else has been talking about so far. So there's something that's working, you know? So while we were talking in that way, and we were starting to get more and more students who wanted to come and do research in the community. And I don't know if anybody's ever heard of the helicopter research that they do, where they come into the community, they take the data, and they're gone. You know, so we never hear about what it is all about. And so, as Mohawks, I don't know if it's all over in indigenous country, but it's like once burnt, twice shy. So we don't dance anymore. We just created a code of research ethics for everybody to follow if they wanted to come into the community to do research. Okay, so they first have to present it to the research team. Then they come and present it to the community advisory board, and then they come to wherever that research study is being done. That's where they have to go, and most of the data that we have is about children. So we're very protective of our children. So you have to come to us in order for you to do anything. And this is part of all that. And it's online if anybody's interested to go through it. Just in case you're interested in doing a research project in the community, this is the steps you have to follow, okay? Our eyes are always watching you, okay? All right. Okay, and so this was kind of like part of the foundation of it, and establish a set of principles to guide the partners to achieve goals, okay? You know how to read, so I don't have to read this to you. Okay, then a statement on the sovereignty of, what do you call it, that we're saying research should support the empowerment of Kahnawake to promote healthy lifestyles and so on, and for Kahnawake responsibility to care for the 7 generations. For us, that's the foundation of everything that we do. We always protect the children in order to ensure that they're going to be the future leaders of our communities and our people. Self-determination of Kahnawake to make decisions about research, and that's why the Code of Research came into, is very valuable in that it says that we have to be part of that initial beginning of any project that wants to come into the community. Okay. Oh my goodness, thank you. Yeah, we'll go for, what do you call it, your patience and your time.